Hi, I'm Renato Calabria, Beverly Hills plastic surgeon. What I'd like to try today in a few minutes, try to explain to you different facelift techniques and help you to understand them a little bit and to try to see which one is good for you. Again, in my opinion, a one technique fit it all is the wrong concept. I think the facelift needs to be custom made to your needs. A 30, 35, 40 years old patient is not the same than a 60, 70 years old. So every facelift technique needs to be custom made according to the need of the patient. So let's review a little bit the major technique in a few words, the way I understand them. And then let's see if we can make some sense of picking what's best for you. All these techniques have very exoteric names. We name them. We're a plastic surgeon, very egocentric, and we name a technique according to some little modification that we made. I'm as guilty as anybody else with my vertical facelift and one stitch facelift. Again, let's see if we can shed some lights about all these techniques. Now, the facelift started in the 1920s, 30s, and it was just a skin-only facelift with incision in front. It was very rudimental, and we just pulled the skin tight horizontally. This technique lasted for a long time, till the 60s and mid-70s, when it was discovered a tiny layer, thin layer over the muscle called SMAS. And this is a layer over the musculature of the face. Now, so then after that discovery, we start doing SMAS facelift. I've done it in the past when I trained, and basically what you do is basically detach the SMAS over the muscle and undermine this thin layer of fibers, and then sort of reposition this mass in different vector, in different direction. Now, this is basically what most of plastic surgeons do as mass facelift. Then this mass has evolved with what we call a composite facelift or a deep plane facelift. The deep plane facelift, what it does is goes underneath the mass, which is this thin layer over the muscle, and also partially underneath some of the muscle, like the zygomaticus muscle, the orbicularis muscle, and it's called composite facelift, and then reposition the muscle and then remove the excess skin. So we talked about the SMAS, composite or deep plane facelift, and then we have a subperiosteal facelift that is basically a facelift that is done under the muscle and underneath the cheek area, and detaching the entire layers of muscle, skin, and fat, and reposition. We all done that in the past, and we found that it was a lot of swelling. The recovery was very long, so most of us that have some gray hair have abandoned that technique. Now, in the early mid-90s, we came up with a endoscopic technique. We actually inherited from general surgery, the laparoscopy with tiny cannulas and scopes, and we applied it to the face, to the breast, etc. Now, that endoscopic technique, I touched bases a few videos ago, and it's basically done through little tiny incision inside the hair, in the temple area, in the face, and the beauty of that technique is that it's scarless. So it's basically, there are no scars in front of the ear, so you can actually make a pocket underneath, going under the muscle, pull the muscle up, and leave it scarless. It's a great technique. I've done it, was one of the pioneer doing it, but it doesn't work for everybody, and it works best for younger patients. In fact, I have an article that I just saw, I think is very helpful, done by a German plastic surgeon called Dr. Hafner, and talks about the temporal endoscopy mid-facelift rejuvenation without facial scars. And the point he makes is exactly the point I was trying to make the other day. He basically said that for young patients without severe sagging and deflation of the mid-face or without severe jowling and neck problem, this scar-saving procedure seems to be the best. And then it goes by saying older patients with significant skin excess of the jaw and the neck are better suited for conventional lower facelift surgery. Again, this is reported in the literature. I'm not the only one who states this concept. And it's important because, again, as I said before, the endoscopic plastic surgery of the face is great. We all doing it. We all do brow lift in an endoscopic fashion. We do mid-face suspension with the endoscopic fashion. But keep in mind that when the skin is relaxed over the jawline, if you don't pull the skin as well and excise the excess skin, the results are not long lasting. And that's the point I was trying to make. So at a certain age, you're gonna need to have a facelift done by removing the excess skin. Some of the surgeons out there combine the two and make you think that maybe just by doing endoscopic work, you get the best, but then in the neck they combine a neck lift together with the mid face. That's a good combination, but again, it's not just an endoscopic mid face suspension, but it's a neck lift. And in fact, the result you can see in this doctors that have done this procedure, that the results are long lasting in the neck but not in the face. So remember, again, my point to make is that your facelift procedure needs to be custom made, and just because somebody is not going to make you the scar in front of the ear doesn't mean that his technique is good for you. The one that I develop, I do different grade of facelift according to the age, from the endoscopy mid-face to the one-stitch procedure to the mini vertical lift to the full vertical face and neck lift with endoscopic brow. So that's why combining the entire technique and pioneer some of the kind of like the vertical repositioning of the tissue, I think is the key. So pick and choose. Don't think one technique is superior to the other. At the end is the skill of the plastic surgeon and his ability to incorporate it, all this technique in one that gives you the best result. So don't go for the glamour, don't go for the magic potion, don't go for whatever it's too good to be true. Don't believe it. Look at result. The best thing, if I had my face done, it's go on the website or Instagram and look at their results. Look at them and make sure they're long lasting. Some of the surgeon out there post result of 1, 2, 3, 6 months, the swelling is there, and so you can't really see the final result. So have long-lasting result. Again, some of the result is a mismatch of two techniques. Some people do a mid-face and then they do a regular neck lift, so they show you the profile view, and you see that the neck lift that was done traditionally is the one that is lasting the longest, but the face that was done endoscopically doesn't last as long. Okay, Take care. Bye.